things that we're seeing here, which are common to everyone with facial aging, is a loss of the jawline. You see it comes in here, and then we see your chin here, and another bump here. So we get kind of this cloverleaf appearance to the jawline. And this represents the aging process wherein all of these soft tissues are going this way and this way. So as they come down toward the middle, we see a line that develops here. This is called the nasolabial fold. And that's where this mass of tissue right here is sinking, again, down toward the middle. And once it gets to your lip, and this whole thing here is the lip, a lot of people think just the red part is, but from our definition, this part is the lip itself. And what I'm doing with that, what's happening with your body with this, is once it gets to the lip, this skin is very closely adherent, almost stuck together with the muscle. And so it heaps up here. In other words, this fat mass can't sink down any further here. It gets to this skin and it starts to heap up right along this line. And so that's what's happening in the mid-face. And we see this concurrent with that, this sort of V-shaped area of relative hollowness under the eye, with the orbital rim, or the eye bone, if you will, being here. And that V-shaped area is really an area that represents tissue that is now down here. So we see deepening of the fold, we see this migration of tissue with gravity, and you're a thin person, so in general, you're not going to have a lot of volume, and what volume you do have in your face is all sinking. And the purpose of doing lower facelift is to reposition all these tissues back up to where they used to be. In the old days, and in fact 60% of my colleagues still do this with skin only, or lifting just the skin, and now there's a much better way of doing it where we're using the thick connective tissue layer underneath the skin called the Maas, and that's doing all the heavy lifting, and then I can just redrape the extra skin to give you nice contour and improve these lines. The other area that I talked about, this area of negative mid-face vector, this is right in this area here. The negative mid-face vector is where this hollowness is, and more commonly than not now, I'll be doing just a very small amount of specially prepared fat grafting of your own tissue to help to lift this area up, this sort of under eye triangle volume loss. So we'll be lifting this back up, true, but there'll still be relative absence of volume here, and we'll restore that with not more than a teaspoon or so of tiny little droplets of fat grafting that we prepare especially for that purpose. And in the end, when we look at this area of tissue gets lifted up. The cheek area, we see this area is kind of the brightest area. That's all moving back up. And it's the same on both sides. We'll see this area get lifted back up to the cheek and where it's supposed to be. We'll see the bright area of your cheek, instead of it being way down here, we'll get this filled in and lifted up through this area. And so you lose all that dark shadow effect and see a nice, this lighter area represents where the highest points of your skin are, where light is reflecting. And then we'll see this nasolabial fold improve dramatically, as well as this so-called marionette line, this little line that's between the corner of your mouth and the jawline. So while a lot of people think of lifting as just sort of lifting or repositioning skin, it's really repositioning skin and soft tissue, so we're able to improve the contour in these entire areas of the face and neck. And along with that, you see sort of the hanging tissue in the neck. It shows up as a sort of darker shadow in the area of your neck here. I'm finishing up this area of the face, and you have to excuse this is sort of Art 101 as I do this. But what we'll see in the jawline is improvement in this sort of lumpy, bumpy appearance where we circled earlier. This area here will come back in, and we'll see nice definition of the jawline here, where that's restored, a nice sharp angle to the jaw. And you do have a good jawline. It's just that you lose it or lose the visibility of it because all the tissues are sinking here. So that jawline gets restored on both sides. And as the jawline is restored, and I'll clean this up in just a minute, we'll see a nice sharp angle to the jaw. And you have, fortunately, you have a really nice chin here. There's a masculine chin. And you can see what I've done, the changes on the left side already. That doesn't mean that every single line, by the way, goes away. So there's still some fine lines and wrinkles. If we want to address those, we'll do a little bit of resurfacing. And the resurfacing when I say resurfacing, it can be done with the laser or a deep peel. And commonly in men, because resurfacing is hard to cover and make up in the early stages, the acute phases, it's about 10 days of healing, we talked about already. The acute phase of wound healing is swelling, and that swelling for most people is pretty much diminished by the first week. And in the second week, even by 10 days, most of the swelling is down, and it's bruising that is really the rate limiting factor for most people in terms of getting back into your normal social activities. And so that's around 10 to 14 days. And the reason that resurfacing with the laser is beneficial when we're doing these areas where we're talking now about fine line treatments, especially around the lips and around the eye area, is that with the fractional laser is healed within about 6 days. We say 6 days to makeup. It's still pink to red for most men who aren't going to wear makeup. That redness is faded within really a few weeks for most people. And so we can see the restore of the contour, the jawline here. This is really an important concept. And in the neck, all this sort of redundancy, the lumpy, bumpy part, goes away completely as we see this improvement. And so what we're showing then is restoration of the jawline, improvement of the neck angle, which I'll show you in a second in side view, and then volume restoration through the area in the mid-face. And really, if we want to improve some of this dyschromias, the discolorations in the neck and the face area, that's where fractional laser resurfacing comes into play. And that's if I show you where we are now. This is you in the current picture, and this is showing you afterward. And what we talked about was restoring volume in this area. So that's the negative mid-face vector, and that's what we do with fat grafting or fat transfer. We often refer to it. This is lifting using this Maas layer. That's the really important concept, using the thick connective tissue layer under the skin to do all the elevating, and then just general tension on the skin so it looks soft and natural. So that's using the Maas or an extended platysmoplasty facelift. And I've thrown a lot of big terms out there, but the idea is to get you natural contour without making you look pulled or windswept. So I'm going to save that image for you. You can see this at home with the touch system. And then I'm going to, and that computer's thinking now, we're saving that. But in the side view, you'll see this tube where this redundant skin is below the neck here. And I'm going to get out of that picture, show you side by side again. So I'm going to save this image just without any markings on it, discussing the things that we talked about doing. We did talk a little bit about eyelid surgery, and if that's not something that you're interested in, you still can see your eyelid shelf. You've got a little bit of it in here, and when we do treatments for that, we'll get rid of the extra skin. But really, you can stay with this, and if you want, that's fine. You can come back and do eyelid surgery at another point in time. Totally fine. So when we look at your side view, a lot of times these things, we don't see ourselves in side view, but they become more evident. We've got this extra tissue hanging down from the neck here. We've got, your jawline, which I showed you before, is an excellent jawline. You just can't see it. It just kind of blends in with your neck, blends with your face. And so what we're able to do is restore that jawline. This zone here is an area of kind of extensive, if you look at the little brown and red marks there, extensive dyschromia or sun damage, whereas the middle of your face has much less. But this is the area that we were talking about where the tissue is sinking down over the jawline and toward your chin and toward your lip in this area of the mid-face that we'll be addressing. So the steps in that, again, are, I've talked to you a little bit about before, but at the end of the day, it's really about getting this jawline restored, and so you can see it again. and that's the mandibular or jawline angle. Well, certainly just as a natural part of this, a lot of these little fine wrinkles, which are not a major issue, are going to go away too. And we're going to see improvement, including those in front of your ear. The extra lines here go away. And I'm going to show you where we hide these little incisions so you can't tell that anything was done, which is the key to this procedure, is doing it in a way where you look better, but nobody can tell you had anything done. If it's not natural, in my opinion, it's not a good outcome. We want to restore this and make you look, just restore the natural contours, make you look good, but make it completely just like yourself, just a younger version of you. So I'm showing this area because it's representing that volume that we often will restore in the mid-face. That's lost. Again, some of it we can lift back up, but some of it, a little bit of fat grafting does a great job of that. It's your own tissue. And it's really, when people ask me about fat, we used to talk about it at our panels about, well, how long does the fat last? And it's really not so much about the fat itself. It's the human or adult human stem cells that are in adipose tissue that we're transferring. And those stem cells are quite abundant in adipose tissue. They're periocytes. And these cells are all what we call, often referred to them as mesenchymal signaling cells, or MSCs, because they signal the other tissues to bring in new tissue to remodel the collagen that's there. And that's why there's more duration than just the fat cells themselves. And then in the neck area, this extra skin is going to be brought back up so that we restore a really solid neck angle for you here. This is what we call the cervicomental angle. And this is an area where I will lift as much as I possibly can and still keep it safe, because there is some tension on the soft tissues here. And I'm hiding the incision, as I described to you earlier, behind the ear. So just to review that, the incision starts up in the hairline, it comes behind this little piece of cartilage, and in front of the ears, it's barely visible right in this crease. It goes high on the back of the ear, and then loops over and goes back into your hairline here. And that part of it, so it's all hidden in your hairline. And how high we go up here is determined by how much of a brow lift we'd like to get. So in general, we're going to get basically from the neck angle down to the collarbone an improvement by doing that incision, gently lifting the skin through about this area, and that underlying tissue, which is called the Maas layer. That's a connective tissue layer of really muscle that's encased with thick connective tissue in the neck, and that goes straight back here. And then the Maas layer in the face goes in different vectors of pull, some straight superior or up, some posterior superior up and back, and some straight posterior, just like we do in the neck, to restore that. So I'm going to save that image, just showing you in general the direction of elevation, all done with that thick connective tissue layer. And once we get those areas lifted, again, the redraping of the skin, because it's behind your ear, the incision here, you don't see anything. The scar is behind the ear. It's a little white line. It's hidden in your hairline and behind the ear in these areas. And I'm going to go back to your original side view here so we can see that again. And then this little extra stuff that's the Art 101 part will not be there, so that this goes away, and we're able to restore a nice cervicomental angle is the term of art for that. Now, how much we can get, again, in a single session is all dependent upon the quality of your skin and circulation. There's an old saying in plastic surgery that beauty is the battle of blood supply. And so this incision up here, I've got to make sure when I put the tension on the neck here that I can still get good circulation, because we don't want unfavorable scarring. If there's a little bit of extra at the end, because of that's maximum pressure, then we can always come back even as soon as a few months later and do a little tuck up to make sure that all of that redundancy is gone. But in most patients, we'll get pretty close to what I'm showing you here in a single session, in a single procedure. Again, this is done under what we call monitored deep sleep anesthesia. You're breathing on your own. We protect the airway with a newer device called an LMA, but you don't have to be paralyzed, you don't have to be on a respirator for this. And when they turn the anesthesia medicine off, you wake up within a few minutes and a little groggy that day, but you feel fine. There'll be a big bulky dressing on your face just overnight. And the next day after surgery, I take that dressing off. And I'll give you little headbands to wear, by the way, for the first few days afterward. And then you can take those on and off. You can wash them. You can take a shower by the next day, not the following day, but the day after we take the dressing off. And we can really take you from this look here, and this is without resurfacing, because if we do resurfacing, we can get a lot of this pigment in this area. But just the lift alone, the lower lift with a little fat transfer, can get you close into that image that I'm showing you on the right here, where you're here right now. And I mean, I think that's really the key thing, is getting people close to where they want to be. I'm going to show you one more feature here. So that's your original picture there. And then if we go to the picture we just changed here, and I'm going to save these so you can see all of them when you're at home on the touch system. I saved that twice. And I'm just going to do a little bit more blending here in this area. And again, this is about mesenchymal stem cells, or signaling cells as we like to call them in here, for improvement in the fine lines and wrinkles. If we want to do that, that really is where we're back to the resurfacing, the laser skin resurfacing. Chemical peels work well, but for guys that don't wear makeup, probably better to just stay with the laser, where it's a 6-day healing period. So I'm blending all those little lines there, and there's your before and after. So this is what I like to call lower facelift, and then the fat transfer, and this is before and then after the procedure. I'll save that for you too. So again, we've gone through all this in detail, but I would expect within 10 days or so, you'll look pretty good, you'll feel pretty good. I just asked a couple things, that you don't do any bending, lifting, or straining. For the first couple weeks, you can get out and take a walk as soon as the first day after surgery. Stationary bicycle is okay when you feel up to it, but you got to listen to your body. And keeping this, really the key things at home are keeping things clean and no bending, lifting, and straining. And we'll give you all the kit with the ointments, the way to keep it clean and take care of the wound. For the most part, we're going to do that for you here in the office. And hopefully get you back there within about 10 days or so and get you back to your more youthful self.